Welcome to today's episode. We have an exciting guest, Harold Davis. He's the president of HealthWorks Better. The company's mission is to transform healthcare financial operations by connecting payers, providers, and patients through innovative and efficient solutions to bring thoughtful precision to every step of the healthcare journey, ensuring clarity, collaboration, and meaningful outcomes. For those of you who are just joining us, we are IQ Consulting and we specialize in helping any business scale their revenue over 12 months. So if you want to learn how to take your business to the next level, just stick around. And if you're interested in a free growth consultation, just drop the word growth into the DMs. Today, Harold, we're going to explore your business model, where you are today, where you want to go, and what's blocking you. Sound good?
That sounds good.
The first question I would like to ask you is give me a little bit more background about yourself, how your company started, and what was the initial problem you set out to solve.
Yeah. So I spent 32 years at Humana, various roles. The last several years was in the payment integrity space. So we found, lots of payment problems, errors, issues by insurance company or by Humana, as well as we found a lot of billing problems and issues that where providers had submitted claims incorrectly. So I had left there and felt like it's time to retire, move on, and do something else. Do find something more fun to do. Kicked around a little bit. I end up here at HealthWorks, who has a really great philosophy, and I'm trying to grow and expand it. But it's try to eliminate the payment integrity piece between providers and payers. That's where we want to go, right? That's our mission. We're definitely nowhere near that today, but there's lots of ways that we could potentially do that. Obviously, I know the payment integrity side. We have some folks that know the provider side. So between the two of us, we should be able to figure out some things that can prevent some of the payment integrity or the overpayment and all the mess that goes around with that. So we're excited about that and that opportunity. And it's interesting, we're seeing a lot of market traction out there and who are interested in such a service. Right now, we've got two verticals, right? We have a provider side that I know work with on occasion, and then we have the payer side, which is the part that I'm leading for the organization. So we're identifying and doing typical payment integrity stuff and then trying to figure out, is there a way that we can move it? Everybody calls it move it to the left, but move it way left, like pre-bill, and make sure that the bill that's being submitted is well documented, can be supported by the medical record, and therefore would reduce or eliminate a lot of the payment integrity.
You need to make sure that the claims are not getting rejected, right? So that's the main goal.
Correct. And there's a lot of denials out there, and there's lots of reasons for that. And just think about ways of how to make that better. Because there's a lot of money, there's a lot of admin spent on both sides trying to fix those problems and those issues. So it would really be helpful for the whole payer provider space and healthcare space to get claims paid quicker, better, faster, and retained by the provider.
Absolutely. What's been your biggest growth driver for this year?
Many things are in the payment integrity space, particularly there's a departments are being shrunk. They keep getting smaller and smaller, but the expectations keep getting bigger and bigger.
The same
So,
story
with
everywhere.
that's right, right. Very true. Um, with that, there's opportunities to kind of backfill what people were doing, and try to get at that and maybe look at it a little differently. You just have to do it or figure out a way to do it at a lower cost so that they can save money, yet continue to find the overpayments that shouldn't have been made, and then essentially helps the payer's financials. So that's where the drivers have been. It also creates a problem because they may want to use your services, but they no longer have people that can help or assist to get a vendor up and going and running. So we're also running into that.
Exactly. So it's not just your company who's going through employees, shortage, but everybody else is as well.
Yeah, that's definitely correct. And so now it's like, well, how do you identify the larger items and ticket items to make sure that you're finding as much as you can and adopting technology, AI
Yes.
continues to move into the space. We're seeing and finding that there's some good technology out there. There's some not so good technology out there. So you just really have to really do like a proof of concept to ensure it's going to get you the findings and the help that it can drive and deliver.
Yes, the healthcare industry is, just very complex, but there's so much advanced. In order to scale or adapt your strategy, you will need to eventually look at AI in the next year, or if not right now, right?
Yeah, that's correct. And there's some AI technology that's been out there, I guess, 5+ years that has really evolved and has really improved. And it definitely makes people more efficient, more effective,
Yes.
able to find more opportunities. You just have to find the right vendor that's right for you, that offers the right opportunities for you to help with your mission.
Yes. What aspect of your business have you implemented AI in?
Yeah. Uh, it's a good question. So a lot of it relates to medical records, right? So there's some good technology out there today that can read the record, tell you if the diagnoses are supported in the record. And I would say in general, what I've seen is that there's some tools out there that are probably about 80% accurate.
Yes.
There are some that it's the technology says I'm not sure, right? It might be supported, it may not be supported. So somebody needs to go look at it. And then, of course, help the model the next time to say either it is or it isn't, right? So the model keeps growing, keeps learning itself. That's where most of the time has been. One, that's a big driver of findings and payment integrity. Two, it is some of the more expensive labor that's used to drive those savings. So that's a perfect place for AI to be utilized in this space.
When you say labor intensive areas, what specifically are you talking about?
Yeah. So typically you will need a nurse or a coder to look at the record, and they're definitely more expensive than somebody who doesn't have those credentials. And then eventually if you do find something, many times you have to have a physician sign off on it. So if you're reducing or taking away a diagnosis, typically you will need a doctor to sign off on that they agree, and that's their conclusion based on, the findings that you have. If you're able to do a lot of what nurses and coders do, they just kind of augment or supplement what the AI does. And then it makes it a lot easier for the physician to agree or disagree with your findings. So it just really kind of expedites the process and truly does make it cheaper.
Yes, it does. And I actually have clients or people in the business that are looking into submitting their claims through AI, and it's not perfect. If AI can handle, like you said, 80% of the workload, the other 20, you can still manage manually.
Right. Agree. And maybe AI gets it 50%, right? And then somebody just needs to do the other 50%, right? So even though it may not get it a whole 100% correct, it may get it partially correct.
What advice would you give to other leaders navigating through similar challenges?
Yeah, so that's a great question. I think that um there's a lot of expectations out there. The medical expense ratios, some people call it loss ratios for insurance companies, are they're 90 plus, and it's really hard for them to make money, quite honestly, and survive at those rates. And yet, you're also being asked to do a lot more. With I do think vendors can help. I do think there's technology, there's some solutions out there that may cost money in the beginning, but overall will help reduce what you're doing and what you're spending. So don't
Mhm.
hesitate to talk to vendors that are out there and have done these type of things. And yeah, there are some sales folks out there, so you have to really kind of listen to what they're telling you and do a proof of concept. And again, I know that's time consuming, takes a lot of effort to pull the data, get the data to the vendor, and then understand what the vendor's trying to tell you that they found with that proof of concept. But ultimately, I think it's definitely something that many have to do, because whatever the problem was yesterday, it's not the problem today. It's moved on to something else, and you always have to be looking for the next thing.
Yes, I really thank you for all your insights. And you mentioned the bottleneck with the claims. I can actually connect you with some people that have great records of advancing it with AI. If you have your 20, 25 minutes to meet again, then we can dive into the workflows or any other bottlenecks that you have. I can connect you with the right people if
Yeah,
you're
sure.
interested. Yeah.
Yeah, that's fine. I would say Thursday or Friday would be my 2 best days at this point this week.
Thursdays and Fridays. Okay, great. Well, thank you so much for this great conversation and all the best for 2026.
Alright, thank you.
Bye.